This is the end session. So as said, SMEs have the opportunity to have a one-to-one with an expert panel. So also in terms of resources for SMEs, industry, we have a website page which has a number of resources on it. So you can actually search by Horizon Scanning Report, dashboard, or by theme. So that's all public access. Obviously, there are some internal documents that we can't share for commercialisation reasons, but there is a number of public-facing documents which are really useful in terms of market assessment, competitor analysis, gap analysis, and free. So I would urge people to look at those there. So yeah, that's the page. That's how it looks. So this is the feedback survey. So it'll go out to all previous attendees, so across all 13, because we're evaluating the whole series. But I would really appreciate people taking the 7 minutes to complete it, just so we have an awareness of what's worked, what hasn't, what we can improve going forward, because resourcing a monthly event, as you can all imagine, is very difficult in terms of you've basically ran an event and you're into next month's event. So getting keynotes, the expert panel, etc., on a monthly basis is a tough gig. And also themes, what's interesting, what isn't, what's pertinent, what's current. So setting those as well. So any feedback would be really, really appreciated. So I'm going to hand over to Dacia, who's going to present from a Department for Business and Trade point of view.
Thank you so much. It's really, really great to be here, and thank you so much for having me. This is not my first time on this stage, and can I just say I always feel very welcome when I come to Newcastle, so thank you for all your hospitality. My name is Dacia Dimsey-Jones, and like Dawn said, I work for Department for Business and Trade. So I am a civil servant. People don't like civil servants, but I think I'm a nice civil servant. And what really I try to do is, if you don't know what Department Business and Trade is, we do our best to support economic growth in the UK. So we help international companies to land in the UK. Doesn't matter sector, it could be life sciences, creatives, green energy. But we also try to support local businesses to export and trade externally. I am part of investment arm, so I specifically work to support international businesses to invest in the UK. So I work across life sciences, I support medtech, digital health, pharmaceutical, biotech businesses, engineering, biology companies. And I work across 170 countries and regions, so I can work with company from India one day, and at the end of the day I will have company from Australia, USA, China, Poland. So my job is never boring. It's so interesting. And not all companies want to come to the UK, so sometimes what I do, I go and pinch them from other markets. I'm not stealer, but I actually go and present and I say how amazing UK is, and I try to convince them to work with the NHS, health innovation networks, and so on. But if I'm serious, when they come to the UK, they look for opportunities. So where would be best place to open their labs? Where can I get funding? Funding is really, really big deal because it doesn't really matter the size of the company. Everyone wants money. And in the UK, we're quite fortunate because we have quite good, and I know people will disagree with me, but in theory, we have really good public funding opportunities and also private funding opportunities. And actually international companies, they very much appreciate that. And the best part of my job, I have another slide, I will show you that later. But my job has changed. So why I really like Newcastle is, around nearly 3 years ago, I started my role within civil service, and I specifically covered investment for north of England. So Manchester, Newcastle, Leeds, Sheffield, Liverpool. And I used to travel to Newcastle nearly every month. So I get to know people across your ecosystem, across the universities and NHS and IHR. And I think what you are doing is really, really amazing. But one of the biggest, can I say, problems as well, that are challenges down is that, okay, I don't want to be too negative, is that not many people internationally know where Newcastle is. You have a nice football team, by the way. They may recognize it by the football team, but not by the fantastic healthcare life science ecosystem that you have here. And for me, it is relatively easy to convince companies to land in London, Oxford or Cambridge, but it's really, really challenging to get them to Liverpool or Newcastle. But I have to say within 3 years in my role, so much have changed, and actually Newcastle have built really unique reputation. And I wish you all, to have that confidence that actually this is the place for business, and never think that you are worse than Oxford or Cambridge. I think this is really, really interesting and exciting area for industry to come and work with. As part of my job, I also am part of a GP program, so Global Entrepreneur Program, and I specifically go externally to attract really small, tech-intensive R&D rich companies to the UK. Sometimes I feel a bit like stealing, but we want that very exciting IP to the UK. And what we offer in return is visa. So we sponsor innovators, founders visa. So if company and founder is interested to move to the UK, then we can help with the visa process. We have the specific cohort of deal makers that are like business trainers, that when companies move to the UK, they train how to access funding, how to do business in the UK. So really, really significant support they can get from the UK government. And those deal makers, honestly, they are amazing. They're not civil servants, so they're investors themselves, they're entrepreneurs, they have built so many companies themselves, so they know how to speak business language. And so I work, when I attract international companies, I work across 170 countries and markets. So what is really, really important for me is to not just get companies over here, but get their culture right. Because everyone will have different expectations. So for me, what I try to do is, if I would work with Indian companies, I know that they would very much match with Manchester because there is India-Manchester partnership. If I work with Chinese companies, it would be Liverpool because there is Liverpool-China partnership. Scandinavian companies really like Northeast because specifically if you're center for aging, so whenever we have Scandinavian or even Dutch delegation over, they're very much interested in Northeast. And these are the areas that I cover. When I help innovators and life science companies, I work across more than 30 therapeutic areas. So it could be anything from vaccines, cardiovascular, pediatric health. And I work, when I bring companies in, I work with experts from primary, secondary, and social care setting. And I would love to work more with international social care companies. And this is what the government really wants, to change the way how social care is delivered. I think innovations plays really, really important role here. For me, obviously, 30 therapeutic areas. I probably have to mention some of my favorites. Shouldn't help, but I do. I absolutely love working with vaccine companies. So I do a lot of work with Vaccine Innovation Pathway and IHR. And it is not just infectious disease vaccines, it's also oncology vaccines and bringing those clinical trials into the UK. Pediatrics is another area that is, I think, in my opinion, quite neglected in the UK. So we need to push more to get more pediatric innovations in. Mental health, female health, renal, because before I became boring civil servant, I was based in the NHS. I worked for 13 years in clinical settings. So I looked after patients with chronic kidney disease and patients on dialysis. And this is the way how I work, how I get the innovations in. So I work really, really closely also with the local SMEs, if I know them, because sometimes some of my local SMEs, they can become part of the supply chain for big international businesses. And NHS and academia absolutely core what I do. And I work a lot with the local governments, mayoral combined authorities, local investment agencies, city councils. And we do need to get the act together if we want to attract that FDI, that foreign direct investment, and we need to work as one team. And then NIHR infrastructure, health innovation networks. And here is just about if you are Don't ask me actually to talk a little bit about our export and investment support. Here, just a couple of examples. If you are an international company and if you want to set up in the UK, there is a lot of virtual support available. And since everyone wants money, I also put a link of the database. I don't know if you know about that, but you can, it doesn't matter if you need grant, loan, any finance support, you can search on this government database by regions, by therapeutic area, and identify funding that could potentially be available for you. But then again, this may be exciting for you. This is support if there are any SMEs. We from the Department Business and Trade perspective, we support you to trade. We want you to get out of the UK. We want to build your resilience. We have opportunities to take you out on events such as Arab Health, Medica, USA Bio. And your guardian angel from my work's perspective would be Ian Crosby. I don't know if you're linked with him, but he's our, we call them ITAs, International Trade Advisor. So if you are looking to expand in USA or Poland or Scandinavian countries, then you should really contact Ian. And under the international support, we also provide something called Export Academy. And if you are a female founder, then there are certain delegations and missions that you can come along with our other female founders and travel to USA in the other countries, which is quite interesting programs. Just to give you a very interesting case, actually, about one of Ian's businesses. You know, I go very often in London. I live in Manchester, in North. But to actually get the sense what's happening, I have to be in London sometimes twice a week. And a lot of London, Oxford, Cambridge companies moan that, life is difficult, everything is really, really difficult, but they never get out. And whenever I'm in London, I try to tell them, have you heard about Northeast? You know, if you want to scale up, if you want to manufacturing, we have CBI, we have universities here. Life exists beyond Golden Triangle. So I try to make them think about it. And there was this one company that I actually met in Newcastle last year, female health company Plexa. Bloom, and they are London-based medtech company. They had this healing device after breast cancer surgery, and basically what they wanted to export. But since they're a London-based company, they don't really get Ian. But luckily, they also had entity in Newcastle. So because they had this regional presence, they were able to get Ian's time face-to-face, and I think they very much benefited from that. So why UK? Why companies are fighting to come to the UK? Sometimes, not always. It is because, you know, we're really, really innovative country. We are, some people would say we are birthplace of unicorns. We have, at the moment, stable government. And our tax system, so we have one of the lowest corporation tax in G7, and we have some of the top universities globally, so very, very desirable place. And then again, it's of course our NHS. About 95% of the companies that I serve, one of the first questions, how I can sell to NHS, how I can get into the NHS, how I can do my clinical trials with NHS. It is really, really, really big, important element when I work with foreign direct investors. It doesn't always work successfully because from 95% of the companies that want to get into it, NHS, maybe 5% success rate. It sounds horrible, but that's reality. So what we also do, sometimes we try to link the SMEs, not just with the NHS, but also some of the private healthcare providers. What else we've got in the UK? We have something called Life Science Innovative Manufacturing Fund. So if you are doing anything in pharmaceutical manufacturing, medtech manufacturing, there is £500 million fund available for you to explore. And then we are convenient location for businesses, convenient time zone, and actually reputation as well. I worked quite a lot with Eastern European companies a couple of weeks ago and welcomed them to the UK. If they are serious in their own market and if they are at the scale-up stage, they need international investment, that actually is really difficult for Polish, Bulgarian, or Latvian company to attract investment. Once they move to the UK, and if they can call themselves UK business, it's so much easier. So we've got that element as well. Oh, sorry, these are my old slides. So it's fine. So I actually had quite exciting photo, but some of here, Dean was with me 2 weeks ago. This is the best part of my job. What we are doing is that I host international missions where I bring companies from, it could be 10 markets, 20 companies into the UK, and I travel with these companies across Leeds, Manchester, Newcastle, depending on the mission, and I try them to physically match with the key opinion leaders, clinicians, investors, any support they can get to establish their presence here in the UK. And this is just about some of the exciting innovation clusters across the UK, not just Northeast, but we're really, really fortunate that we also have UK catapults. The ones that I tend to work more is the Cell and Gene, Medicines Discovery, CPI. You're really lucky to have CPI next to your door. And then, I work closely with the UK Research and Innovation because, again, they're really good partners for our missions. And another element why companies choose to come to the UK is that we have quite supportive tax system when it comes to R&D intensive businesses. I work a little bit with AMRC, so Association of Medical Research Charities, and it's so fabulous that we have some of the charities that in the UK, there are, I think, around 200, I think now, and they not just fund research activities, but sometimes they even act as a VCs. They invest in companies. I think it's Parkinson's UK Cancer Research. So that's a really, really good element. And then some of the key organizations, you probably know quite a lot of them, but they have really good international recognition and reputation. And then, of course, Health Innovation Networks, one of my best friends, innovation arm of the NHS. There are 15. I don't work equally in harmony way like I do with Northeast, because I really like Northeast Health Innovation Networks, but I tend to work more with the Northern Health Innovation Networks, I have to say. And they usually our trusted partner when we host delegations. I'm so sorry, this is really, really old, but I think this is kind of like evidence I was able to find. And what drives me, why I am really, really energetic about bringing those true innovations into our ecosystem is that this slide really drives me mad. And when you look at the health inequalities and life expectancy north of England, we don't perform. We're really, really bad. We lag behind. And it's not just about economic growth. It's about people's lives and opportunities to get novel treatments. So for me, as a living in North, it's the fuel for my energy. And then really, really quickly, I work really closely with the Research Delivery Networks, BRCs, also health tech research centers, which are quite a valuable partner for my international SMEs. And yes, CRFs for larger companies. It's absolutely amazing that we have these clinical research facilities for both for pediatrics and for adults, that larger companies can come and run first in man early stage clinical trials. And again, that's really, really big asset for us. And those are my crazy children. And whenever I had opportunity to involve them in clinical trials, I do that. And some of the pros and cons about the UK, this is feedback from international companies. I'm not going to talk about pros, I think we all know them. But yes, for international companies, one of my major challenges is that it's really, really slow. It's really difficult and really long time to get innovation adapted into the healthcare system. Really complex life science ecosystem. We have so much, but it's impossible to navigate. And regulatory also slow and complex. Then sometimes competition in certain regions, and that's why I try to tell companies, I wish you go to Oxford. The competition is going to be much higher than maybe in Darlington or Leeds or Newcastle. And productivity is one of the feedbacks, actually, and I'm so sorry to say that, but when international companies come to the UK, they expect from their workforce better productivity, and here it comes to specifically on business development. When companies come to the UK, they have UK director, and because they've been told, if you want to succeed in the UK, you need UK director. But actually, I don't think we have that many good business development managers that helps those, that understands the mentality of SMEs, how they need to grow and how they need to succeed. So this is a bit of like failure, if I can say, as a civil servant. I hope I'm not getting in trouble. And then those awful forms, honestly, everyone, you turn your head, form. And it drives my companies mad. And you fill the form and you never hear back. So I hope we can change something about that. And then we produce something called high potential opportunities, and this is different sectors, vaccines, cell and gene. We had one for Newcastle relating to longevity and aging and biomanufacturing in these valleys. So these are documents, I would say PowerPoint slides, about 20 slides, about very easy to read when companies are naive to the UK, where to go, what are the assets across the region and how to explore ecosystem. Freeports, I don't know if you have heard, investment zones, specific regions that, specifically investment zones have been awarded 160 million for next 10 years across different sectors, advanced manufacturing, digital health, medtech, green energy, and they've been awarded combined authorities to help to grow the sector. And I'm so sorry, I had other slides, but if you share with everyone my latest version, that would be amazing. I had really great picture, actually. Dean, you were on my picture, by the way, because I just wanted to say I'm really, I wanted to pay my gratitude to all people that have helped me to bring international companies here, because it's not about me, it's really about you. So I would be really delighted to connect with you virtually, physically, any way you like. And yeah, please come to me, and if something bothers you, I will not get upset. Please tell me your feedback, and I try to feed it back. Not always I get ears that listen, but I try to, because life science is absolutely really important sector. Slide was about the new modern industrial strategy, and life science is one of the 8 pillars. So this is going to be really important for next 5-10 years. So thank you. Can I take questions, or do I? Oh yes, I'm sorry. Yeah.
Has anyone got any questions for Dacia? She's got to shoot off, so she won't be able to do the panel. But has anyone in the audience got any questions specifically for Dacia?
Must have been really terrible.
Here. Northeast. What are the tax aversions that they need to look into? Your last slide, investment zones.
Investment
I see
zones.
a lot of taxes, categorization. So what are the things that I should look forward to?
So you probably would need to find a space, if there is space. It depends on your business, if it's AI business, or if you're doing some manufacturing, or if you need labs. I heard that the lab space here in the Northeast is quite difficult to get by. And I would, one of my, I don't know if it's true,
I think Sam's going to cover that in his presentation.
So I would also link in with your combined authority with Invest. Is it Invest Newcastle still called? It's Michelle Dugan.
Yeah, part of Northeast Combined Authority, Michelle Dugan.
Yeah, and then if there is any soft landing opportunities as well, because many regions offer 6 months free of charge space, and if you don't need labs, and if you want to see if you could succeed in Northeast, then maybe there is opportunity to try that for free. Tax can be really complicated. I'm not tax expert, but there are people that can explain, how to get, even if you're a loss-making company, you get quite a bit of money back that you have invested in your R&D. That's really good. And then again, what we try to encourage companies do, if you are even very small, young company, think about your international journey when you start. So just think about setting up in the UK, Newcastle, but how are you going to expand, and what you can utilize, what access you can get for free. Health innovation networks, definitely really important if you want to build your proof of concept, real evidence, your proof of concept. And I think at the end of the day, it's all about networking. And you will meet people that will lead you from point A to B. And you really, I think as an entrepreneur, your biggest asset is your network. And then maybe government can be also supportive. Thank you.
Oh, thank you, Dacia.
Thank you
Thank
so
you very
much.
much.
Thank you.
Safe journey. So next on stage with a keynote is Andrew Hodgson from Innovation Super Network, powered by UMI. So I will hand over to Andrew.
Can I see the notes on here? I can, can't I?
Yeah.
Hi, everyone. Yep, so as Dawn says, my name is Andrew Hodgson. My background is industrial designer and with a focus on circular economy, and I've raised in the past, set up business in the past, developed technology in the past, and now work for UMI as a access to finance manager. And for the past 4 years, we've been working in sort of that space, trying to help people raise early stage capital, and more recently, trying to help with late stage capital as well. We have a few main projects within UMI. So we have a North East Combined Authority funded program which supports access to finance, but we also have a national program called Get Funding. And we understand that many people have little knowledge of the types of finance options available, so Get Funding is designed to try and help organisations identify the best type of finance for your current position. So we really look into regional R&D, CapEx, expansion grants, debt, or we do a lot of work around equity investment as well. And so our support process follows the investment readiness levels. So with my background being in industrial design, I really felt like a lot of people, when they're looking for investment, they'll come at you with a really fancy looking pitch, but don't really have too much behind it. So we really wanted to sort of strip that back and develop a comprehensive 9-step process to ensure that everyone had everything in place before they then started looking for that investment. And so we developed this, and yet based on technology readiness levels, we can support people at any stage of that, and the idea is we can really work with you to help de-risk your investment opportunities through communication of the business, the market, the opportunity. We often talking and working with innovators, they're very good at being able to explain and communicate what the product or service does, but trying to communicate the commercial benefits of it to an investor or a customer is another thing entirely, so we really help with that. Once you get all the way through, we help with the business plan and your data room, and then that's when, once we've got to IRL 9, it's really easy to put together a pitch deck, a application for Innovate UK work, or some debt. And so we really try and help everyone get to that stage. Through our North East Combined Authority project, we've developed the Northern Investor Hub, and that we set up because there was just a real gap. There was an organisation called North Invest, but that ceased trading, and so we really try to develop an angel network in the region. We've been going for about 12 to 18 months, and we've got around about 76 people onboarded. That's split between about 50% of them are angels, and the rest are local and national VCs. One of the hardest parts of raising finance, we think, is finding the appropriate investors. As often you'll go onto a website and they'll say, yes, they do invest in X, Y, and Z. Yes, we do have money, but in reality they don't because of the funding cycles or various other things. So we really try and just cut that bit out. And if we can introduce people to people who are investing and are interested in the space, then we feel like it's a bit of a win and we've saved you a lot of hassle. Through the Northern Investor Hub, I've just thought I'd add this in. We are an investor partner for Innovate UK Investor Partnerships. It looks like they're getting rid of smart grants, and investor partnerships is a great way to ensure that people are thinking commercially as they develop R&D. I think in the past, a lot of people would be doing smart grants or other smaller projects, and then the research would get shelved. But with this, you have to have investment to sit alongside the grant. In fact, you don't get the grant until the investment's in, which means that you've got an investor cracking the whip to ensure that you are commercializing the technology, and you've got a clear route to market, and you've got a clear commercial progress in place. The grant funds 70% of the R&D, which means the investment can go more into the commercial activities, which is good for the investors and good for the people that are developing. And I think that there's going to be an iCure to investor partners. I think there's a pathway, and I think there's going to be an iCure investor partnerships. But if we know more, I can share that with you at a later date as well. So the main presentation, it was just to sort of have a look at the current investment landscape. And to be honest, it's a bit hit and miss. I think it's the easiest way to put it. There's some positives and there's some negatives. So for early stage, VCs are less risk averse, which has seen a lot of funds going into portfolio companies. However, New British Business Bank schemes are aiming to combat this. On the angel landscape, there's 36,000 UK angels, which is quite unbelievable. Unfortunately, 14% are women and 11% from ethnic minorities, and almost 60%, but actually I thought it was probably going to be higher, 60% are in London. So we've got 40% in the rest of the entire UK. 50% of that 36,000 though have got 5 years or more experience in investing, therefore really do understand the investor journey. And more of these angels are looking for positive impact rather than just the typical immediately returns that they've looked for in the past. Health and biotech are seeing comparable growth, and diagnostics, AI, and drug discovery are showing sustained investor confidence. So we'll have to take that as a win. 2024 saw 6 first financing Series A or seed rounds of 40 million plus in the UK in biopharma alone. So, yep, it is a difficult area, but we're getting there. For Series A and later stage, we've seen an increased rounds of being between 5 and 8 million, so that's shifting up quite quickly. Family offices and institutional LPs are co-investing alongside traditional VCs. Total venture funding for the UK life sciences rose 36% year on year last year. Q1 2025 saw a record high in quarterly VC funding, and it was the highest money total since 2020, but it was the lowest number of deals since 2020 as well, so it's showing that there are larger check sizes, but a lot fewer deals going around. And sort of just to add to that, annual recurring revenue expectations since 2021 have increased by 115%. Valuations have pretty much remained the same, and the number of Series A rounds funded has almost halved since 2021 as well. It was mentioned earlier, but just a little bit about the Foreign Direct Investment Report, because the EY has recently released about 3 weeks ago their attractiveness report. Overall, I'd say due to the macroeconomic and geopolitical climate, foreign direct investment declined to a 9-year low. Growth is slow, confidence is cautious, and global competition is intensifying. It's just the reality, really. But however, the UK was Europe's overall leading destination for life science foreign direct investment, with 86 projects. Majority involved either manufacturing or R&D, and the broader healthcare and life science deal market saw modest improvement in setting the stage for renewed M&A. United States was the leading source of life science investment, contributing to 27 projects, which were 12 pharmaceuticals, 9 medical device, and 6 health and social work sector projects. And then Switzerland and Poland were joint second largest sources of FDI into the UK. Now just a little bit about who is investing. Firstly, these are like the international VCs, and so these are the top 9, not exclusive. A little bit about it. In May, HTGF led a seed round of 3.3 million euros in the Medical Decision Alliance to develop comprehensive surgical support systems. In April, Summit Partners Managing Director Darren Black and Ross Stern were named GrowthCap's list of top healthcare investors in 2025. In April, Arch co-founder Bob Nelson was named Stats list of most influential people shaping the health industry, and BioAdvance Capital have invested into 100 and exited 15 health-focused businesses. So they are some of the ones that you'd, if you were looking internationally, globally, definitely get in touch with. And on a UK side of things, we've got another 9. And so Parkwalk Advisors participated in 23 fundraisings, totaling 58 million, with an average fundraisings of 2.5 million. And they normally take around a 24% stake, and the valuations are generally around 16.2 million. They've recently invested into a medical device company, 1.75 million, and Parkway and Northern Gritstone have recently launched the Northern Universities Venture Fund as well. Deepbridge Capital has participated in 11 fundraisings totaling 5 million with an average of 500k. So if you're looking for that earlier money, they're probably a good one to go to. And they take around 12% at a valuation of 5 million. Octopus Ventures is quite a large one. They've done 422 fundraisings totaling 4.14 billion with an average of 10 million, and the stake taken by investors for those deals is averaged about 28%. And then finally, we've got Archangels, who have participated in 204 fundraisings totaling 252 million, average about 1.42 million, and they tend to take about 24%. So that's sort of the whistle-stop tour. It's just, I think, to put it, it's quite a difficult landscape at the moment, and all we can really do is look at ways that we can support you to enhance your offer and de-risk it. And so there are many ways to do this, such as developing your IP portfolio, having a clear route to market and realistic timelines, but three of the things that are up there are what we'd sort of focus on. So the first is engage with your next funders as early as possible. Find out their requirements to invest at the next stage and the milestones that they require. Co-create your technology and commercial roadmaps with them. The next one, and it's quite prevalent in this sector, is ensure that the team has clearly defined roles. So often there'll be multiple years before there's a real return. And so investors are wanting to know what that specific staff costs are going to, because sometimes staff costs can be pretty much the majority of the investment. So ensure they've got clear roles, their activities are well defined, and that milestones are explained clear enough to ensure investors understand that. And then it has an easier conversation. And then finally, co-development, partnerships and joint ventures are a great way to add value. They validate the technology and R&D, but also the commercial opportunity. I think companies in the US are far more active in this, but we are starting to see shift over here. And I think as well is sometimes you get in the development technology frame of mind a bit too much. So with all of these joint ventures or partnerships, ensure that it's clearly defined what the commercial roadmap that sits alongside it is, because that's going to be what's going to be attractive for investors further down the line. Oops, and that's it from me. So any questions, just give me a shout. Thank you.
Brilliant, thanks Andrew. Andrew is going to be on the panel, so if you've got any questions, we'll hold it to then as part of the fireside chat. And going to hand over now to Sam, who's the CEO of Lightox, and he's going to talk to us about his global experiences.
All right. Hi, I'm Sam Whitehouse. I'm CEO of Lightox. I'll tell you a little bit about Lightox because I have to. You know, if you stand on stage, you've got to say something about your company. But I think in terms of what we're talking about here, it's important to understand a little bit about what I've done in the past. So I am from London originally, hence the accent. You know, I haven't really worked in London other than raising finance. I was in Sheffield for a long time. My first company was sold to Bayer Materials Science. I started a small company, moved it up to Newcastle, raised about 110 million into that company, put a product globally, built probably the largest private laboratory structure here in Newcastle. And Lightox is a combination of what I think is a very interesting platform technology, science that came out of Durham. Durham doesn't have an incubator, and I live in Newcastle, and everything's mildly selfish. So we are based in Newcastle. We used to have labs in the biosphere. We moved out recently, and I'll go into why that is in another time. But we raise money from all over the world, and there is a reason for that, and it's because access to good financing for taking a large step forwards in your value chain is very, very difficult in the Northeast. Access to finance is poor. Out of the list that you've just shown, it's very sad that very few of them are based or even have an operation in the Northeast, and this is why we suffer more so, and all of those statistics won't change unless we do something about that. The government is trying to do something about that with the Mansion House Agreement. They signed it in 2023. No money has flowed as yet. The Mansion House Agreement is a statement that all of our pension funds will take riskier projects in order to make larger returns in order to help our pension funds not run out of money as we all get older. So I'll go into some of this and why and how I do things, but you know, if anyone has any questions, shout them out, write them down, or just send me an email. This is our technology. This is what we do. We basically made a drug. This drug is light activated, so it only works when you shine a light on it, which means we are a drug and device combination. I wouldn't recommend that to anyone. It's always a difficult place to be. We don't do antibodies yet, although we can couple our drug to an antibody and target it, but that's early stage research. But essentially, we've designed this drug in a very simple methodology. So you take the drug, I call it a fluorescent Bonjela, which works in this country, but not everyone knows what Bonjela is elsewhere. Oragel basically is another comparison, but you basically paste this onto a cancer in your mouth. So oral cancers present as patches in your mouth, and you'll see that in a minute. You place this on, you allow it to soak in, 10 minutes later, you shine the light on it for a minute, the patient goes home. Why is this important? Because it's a different way of looking at chemotherapeutics. So it is a chemotherapy, but it's only active when you shine the light on it. So these are what it looks like. This is a patient from Liverpool. I will constantly come back to the fact that all of this work has been done in the north of England. So we work with a clinical team in Liverpool. This is a patient in Liverpool. This is what a oral cancer lesion looks like. This is early stage. Early stage is important because your options are very limited. So you do the biopsy, that's rather painful. You get your diagnosis, and then the clinician has a choice. You either go into, we're going to wait and see what this turns into. That's not great for the patient. Or we remove it, and unfortunately for this gentleman, he had the left side of his tongue removed. Sorry for the gruesome pictures, but this is the reality. And this is the option for 95% of all patients. The other 5% are watch and wait. And if you go into radio treatment post-surgery, then unfortunately you may also lose your salivary gland function, which means you suffer from dry mouth, etc., etc. Chemotherapies in this area don't really work unless it becomes secondary. But you have to include those into the statistics. So these are the options, and what we want to do is essentially provide a very simple solution for these patients. So by understanding your patients and your pathway and your clinicians, and this is why interacting at all these different levels very early in the journey means that you end up with a product that people actually want. The product itself is in the top left-hand corner. It looks like a yellow gel in a pot. When you take it around, it kind of feels like you're taking hair gel, and if you're taking a drug over borders where they don't like you doing that, you call it hair gel until you get there. But essentially that's what it is. That's what we've made. It is a gel. We make the API, we make the gel. We do all of this with collaborators. So our API is made by a company called High Force Research, which I used to own down in Durham. The gel is made over in Liverpool, and we brought that back in-house as well. But essentially what we're doing is we are applying the drug, we target the cancer, we light it up like this gentleman has here at the moment. It's all done within 15 minutes and the patient goes home. The interesting thing about this is, as we've done all of the animal work and everything else, we start to see these lesions disappear within a couple of weeks. So we are at the point now where we want to take this and put it into a human being next year. So that's where we are at the moment, and this becomes interesting because now we have decisions to make because we have an active drug. So the point of this discussion today is more about how we take these things, how we take our technologies and how we move them into a global market, how we raise finance to do this. Litox is majority owned by Dutch investors. So our largest shareholder is Dutch, and they joined us in 2019, and they have reinvested since then, and that's why we are where we are, because it's very easy to fly from Amsterdam and Eindhoven over here. We have money locally from North Star, and we have money from Manchester, from Procura, who recently merged with Par Equity a couple of weeks ago. So we have taken money from specific investors, as in life science people, but also generalist investors as well. And the reason why I come to this is a lot of the people who are based in the Northeast, who are investors or call themselves investors, are not fundamentally life science investors. And that's important because the way life sciences works is we very rarely make any revenues until we sell. So our drug will go from being its valuation at the moment, I don't mind saying, we value the company at 30 million quid. We will raise 10 million quid to do the clinical trial, and then we will probably either license or sell the company at the point at which we have clinical data, probably in 24 to 36 months' time. So it's a relatively short amount, but this is the way this game works. It's a value proposition. So we don't make revenues, we don't have EBITDAs, so valuing these companies is difficult. It also means access to finance is difficult as well, because most of the funds that you mention are debt funds, and unfortunately IP isn't considered debt. So how do you raise money? Where do you go to? You go to places where people actually do value the IP that you've generated. So I spent a lot of time in India last year. The Indian population has the largest oral cancer burden than anywhere else in the world. So I was in Kerala. I was invited by the Kerala government to go and talk to them. You are 20 times more likely to have oral cancer in Kerala than you are in the UK. This is because chewing tobacco, smoking, drinking, betel nut production has doubled in the last 10 years. We vape here, so we're going to get back on this soon. But this is important because if you're talking with investors and they see the burden, then you are more relevant there. It is number 2 in China. It is number 1 or 2 in most of Southeast Asia. So I've spent the last 2 months running around the world. I was in Singapore 2 weeks ago. I was in Hong Kong, and I've written a piece on the website if anyone wants to read it, around raising money in Hong Kong. We're in Boston next month. And we are going around and talking with people in the areas where we think that this drug holds the most amount of traction, but also for where this drug might be licensed to. So it's really important that you do that. We showed how many angels there are in the UK. That's 36,000 angels. That ranges from someone putting 10 grand in up to whatever else. There are 2,500 family offices in Hong Kong alone. So at that point, you're changing the metric of where you go. We've raised a lot of money in previous companies of mine in Singapore, and you have connections there. But also Singapore strategically is very interesting because of where the disease burden is and the access to Southeast Asian markets from there as well. So where you raise money is very important relative to what product you have and what disease you're focusing in on. And this changes dramatically if I talk about the next product that we have, which is a different drug, which is in wound care. So I would talk slightly differently if I was talking about the wound care project. But funding alters your decisions. So when I talk to my board and I talk to my funders so far, we have a mixture of UK and European funds. And so therefore, running a clinical trial in Liverpool with our team there is my first choice because it's close to home and we can do that. We have access to patients. But what... Yeah. Yes, so we know Professor Jones.
And did you sponsor the trial or did you get funding for it?
We are looking to do that at the moment. Yes. And I can come to that point. So, I mean, at the moment we are at the point where we are raising this money. We have investors from Singapore who are keen to put in a cornerstone amount. They don't really mind whether we run it in the UK or in Singapore, but that is a choice that maybe the money will choose. We spoke with the NIHR recently, and we are a new chemical entity. We haven't been in a human yet, and so therefore we were told that we weren't eligible for the EME programs, etc., etc. And I think if I come on to that, so the way that we treat SMEs in this country is really interesting. So more than likely, and I've worked for pharmaceutical companies, and you look at where their product pipeline comes from, they come through acquisition. Very, very few of their drugs actually start within their own doors these days. 20 years ago when I worked at MSD, maybe that's true, but now it is not. But in order to get onto the MHRA, and I spoke with the CEO of the MHRA in Parliament not too long ago, and he's only 3 months into the job, so I'll cut him some slack. But we get a discount as an SME working with the MHRA, but it takes them 7 months to tell us that we're an SME. And we have to apply for this every year, which gives us a 5-month window to actually work with them. And everyone else in the room who are either incredibly well funded, which there are some in the UK, or they're multinationals, have no problem working with the MHRA. So that is a That is a difference that we see quite a lot, and it is something that he wants to address. So obviously I took his mobile number. I don't mind being a case study, I'm happy. So the way we treat this is important. Now, if our drug had been in a human before, or we were repurposing this drug, we would have access to the EME program because that's already gone into a human being. So are we actually supporting new modalities and new drugs, or are we just repurposing other things? So that's another challenge that we have and something that we come up against. And when I'm choosing clinical trials sites, then we also then have to look at funding available. So clinical R&D funding in Australia is 43% tax burdens, and we can go into all the nuances about this, but that's where we are. So you get 43% of your money back for running a clinical trial in Australia. You also have a lower barrier to entry in terms of what you can actually put first in man there as well. And when it's important, though we highlight what we are good at in the UK, it is important that we do that in comparison with other places you could run a clinical trial. So with all of these things, you have to make these choices, and the reason why I'm spending a bit of time on this is because this is the decision point that we make now as this company, and whether we want to be a UK company or not. Because I honestly don't have a problem being Singaporean or doing this in Hong Kong or Australia or anywhere else. But I won't.
I'm sorry, can I just this
Yeah, no, go.
really upset because in theory, okay, this gives novel opportunities for patients. So obviously,
Yes.
if you take the trial somewhere else, then
We-
we lose the country.
Yes.
It's not just about the company. It should
And
be recognized.
absolutely. And I think ultimately we have this choice as to how we fund. So I think government is making inroads into, we need to fill that gap. We only need 10 million, which for a clinical trial is a relatively small amount. But if I can't raise it here, I will raise it elsewhere, and those investors will probably dictate where they want this drug to be made. And so therefore we move into this cycle. Now, that would be a real shame because this is a Durham spin-out, Newcastle-based clinical trials in Liverpool. All of our animal work has been done in the north of England. The only thing that we haven't been able to do is raise finance here. So this annoys me slightly, as you can probably tell. But it's the reality. And so therefore the reality of this is we will go and raise this money, and we will go and do what we need to do in order to actually bring this into patients. And we work with a lot of patient groups. We have, patient affidavits and, patient advocates that we speak to. And I won't mention her name, but we have a patient in London who is on her 8th surgery. So these cancers keep coming back because they are lifestyle-driven cancers. She's never smoked, she's never drunk, but she has these cancers that occur in different areas of her mouth, and you can imagine what it is like to lose part of your tongue and then 6 months later be told that you're now going to lose part of your cheek. So 15 years of her life is living with this disease. And I'd like her to be on our trial. So I'd like it to run in the UK. In India, I met a 14-year-old boy who'd been chewing tobacco for 3 years and had lesions all up one side of his mouth. So this disease burden is global, and I would like this drug to be available everywhere, but we have to get it into a human being first, which means that I have to raise this money, and I have a very short window to do this. So all of these things are all true, and they are different according to the type of company that you run. So I think a lot of investment in this part of the world chases early revenues in order to make a company stable rather than late-stage values that make a lot of money later on, but require a larger risk appetite. So all of these things are there. And the reason why my experience of raising capital from foreign investors is because I think we have this sort of internal view of, the Golden Triangle gets all this money and the northern aspects don't, and there is truth behind that, but international investors don't care. So it's easy for me to fly into Hong Kong, to tell them I'm a UK company, to tell them that I'm running a clinical trial in Liverpool, and would they like to back it? And the answer is yes. How much do you need? And when I say 10 million, they go, oh, sorry, our minimum check size is 20. And you say, well, I'll take 20. I've got 2 drugs. So I think setting, and like you say, I think, you know, when we're looking at how we pitch our businesses, it's important that you use the right language around that. So we say Series A 10 million. Series A 10 million is not a Series A in the US. So don't use the word Series A in the US when you're talking about 10 million quid. But you're jumping from preclinical to clinical, you're jumping from value to value, and it's important that you don't nail yourself down in terms of how you want to approach this. So a real life conversation, our investors in Singapore, you know, they want to fund the clinical trial, they want to know how much it costs from here to a human being. Not 50 patients, here to the human being, because they can do that. And I said 2.5 million quid. And they said, right, let's do a deal then. So they want to push that value forwards, put it into a human being, and then raise the rest of the money to do the rest of it later. I don't mind either way. I would like to have more money in the bank at any one time so I can run faster and harder at things. But the reality of that might be actually we cut a deal, lower value, smaller amounts of money, but pushes the company forwards faster. I don't mind either way. So you have to have an idea of where you want your company to go to, but you have to be flexible in how you want to get there. And ultimately, like I said, this is a platform technology. So I want this data. And the reason why I want the GMP material is because I've shown that oral cancer as an example of what this could do. But essentially, as long as you can get the drug there and the light there, then we can run a clinical trial there. So we're very interested in skin, and the same drug could be used in skin. Cervical cancers, exactly the same. We have screening programs for cervical cancers. There is no reason why this drug couldn't be applied to the back of the cervix, shine a light on it, kill the white cells, away we go, and we move forward from there. I could run multiple clinical trials if I had the money to do it with the same drug, and then I'd have multiple exit points along the way as well. So all of these things are related to how much money you can raise, how you can pitch, and also where you think this disease is most relevant. And I'll leave it there. Thank you. John?
If anyone's got any questions for Sam, we're going to open onto the panel now as well with Andrew. And Datcha, you've got to go. Yeah, I thought you did. I was just checking because you were still sat there. I don't think we've got any questions online. Has anyone in the audience got any questions?
Hi, I'm Cole from Lightopt. Questions for Andrew. I think Sam mentioned about risk appetite, and you know, the larger checks being cut for fewer deals. This might sound, you know, very depressing, but is there anything we can do bottom up to try and change that risk appetite? Everyone wants, you know, the funds want to invest in the 3 companies that are going to exit, not 30 companies of which 3 are going to be successful. Is there anything we can do bottom up? Is there anything government can do top down? Some of these pots of money are from government. I guess just what do you see in terms of horizon scanning? What do you see that it going?
So the way it splits in our organisation is I get people ready for investment and then I hand them over to my colleagues who do the investor outreach. That allows me to be a bit more honest, I think, on the investment side of things. And I think one of the key things for me is when we get these British Business Bank funds, there needs to be more at that stage for people to go to the right people that understand the riskier opportunities. I think one of the things, and you've mentioned on your last slide, SMEs, there's so many different classifications of SMEs, and I'd say everyone that's working in this area, it's more innovation-driven enterprises rather than SMEs, and everybody looks at everything through this SME lens, which is the case of, the recurring revenue, or where you're at. And so I think government can look to the funders to get the right people in charge of those pots of money, all we can do as businesses is really go to the Hong Kongs, the Singapores, get people interested, and then try and drag the people in the region or the people in the rest of the UK along with us. That's sort of my... So yeah, it's tough.
I don't know. I think if you're looking at risk appetite, then what you want to do is show people actually the rewards at the end of this. Does this work?
I had to switch
Oh yeah,
that
if
one
you
on.
can hear me, that's fine. I was just thinking about the people online. Cool. Yeah. So we have to showcase why investment in these types of things work. So when we look at life science, everyone goes, "Oh, it's really long, wait times. When's my investment going to actually return? Is it risky enough? How many bets do I have to place in order to cover my investment? But also, where's my return across the portfolio?" And we don't really sing about how much we actually do. So if you look at, and there's a great piece from the BIA, if you look at the top 10 therapeutic exits in the largest one was like 22.1 billion, and the top 10 of those were all backed at some point by the biomedical catalyst. So it shows that actually we do have the innovation pieces in play, but we are exiting a lot later. But we do make, and it's incredible actually the amount of money that goes into tech-based companies, fintech, things like that, that are very short-based cycles, but incredibly risky. And you might be lucky and pick the two guys in a garage who happen to make the app that takes over the world and are worth billions. But Uber's never made a profit. So at some point you might make money out of that game, but eventually the cards will fall down. If you make a drug and it's successful, more than likely it's going into human beings, and more than likely it's worth a lot of money. So I think we need to stage it better, and we need to actually sing about the best things that we've done and where we were in that chain, and be proud of the fact that we were probably at the beginning and fostering those things, and that might attract earlier investment into our companies from there.
Sorry, a question.
Okay, Dean Fowler, so from Henning. Rachel Reeves is just about to do a speech to the financial capitalists, and you've talked a lot about the barriers. If you could get her to wave her magic wand and take away the barriers, what would you advise the government to do to incentivise those people, the pension funds, etc., that've got money, to refocus in on the UK?
I think so. I think as we move towards this sort of idea that we're going to spend 5%, of our pension money on riskier things, we have to have people that are, one, experienced and can show the track record of pushing these things out. So there has to be a certain amount that does that earlier stage stuff, the British Business Bank stuff, etc., etc. But one, to use an example, Epiderics, based in Edinburgh, they use Scottish government money. They set up a fund. They invested exclusively in therapeutics, but not necessarily just from Scotland. And that way they were able to actually diversify their portfolio, attract other investment from other parts of the world. They've got, hedge funds and family offices from the US. And now they're sustainable because they're reinvesting in the second fund. They're based in Edinburgh still. And so therefore that's completed its cycle. And ultimately, it's not government's job to try and stimulate, private investment. But if we don't have it at all, then we just keep it investing in the lower parts of this journey, and then we lose the upper parts after that. So I think, we have incentives at the lower end. We have SEIS, we have EIS, and they're great. And we have R&D tax credits, and we can talk about whether that's competitive or not. But I think ultimately what we want to do is leverage at the highest level in order to then bring much more capital in. And what we tend to do is drift this money down to a level and then try and leverage it. And so I think it's much better to try and do that right at the top, right at the very top, and go, we've got 85 billion in pension money. We already have, you know, the Canadian pension funds investing in the UK, Turkish pension funds. Leverage them. Say, look, we're going to use ours. You use yours as well. You know, now we've got 150 billion. That to me would be a very sensible way of the politicians leveraging money from elsewhere at the highest level to maximise what we're able to use in the UK. But we'll wait and see whether she's still in a job or not. Slightly different.
I've nothing to add on that. I think that sums up everything. Yeah, that sums up everything completely.
I think we, as part of the ecosystem, could do a lot more in terms of signalling into government policy and strategy. Speaking from a personal point of view, I think there's something there that we've got a role and responsibility for, that we collate this data, these insights, and that goes straight into ministers, select committees, etc. I think we could do a lot more, personally speaking, and that's completely personal. That's
No, and I think it's very true that so the ecosystem has to exist in order for people to have the confidence to invest. So I invest bits and pieces, you know, small amounts of money here and there, but ultimately, if that's not backed up by larger pots of money, then my investment's at risk. So you have to create the chain, and that's, you know, what Umi are looking to do in terms of bringing angel groups together, showcasing what we have here. I mean, you don't really care whether your angel's based in the Northeast or in Henley or, you know, wherever else. So we should be showcasing what we're doing, but then that has to be backed up with, well, who's going to invest behind me? You know, is that going to be an Octopus? You know, is that going to be an Arch Ventures? You know, and I think a lot of the time we sing about the fact that we are, you know, we manufacture in the Northeast and we're very good at that. But we manufacture on behalf of a lot of these companies that are based in the South, you know. And I won't use specific examples, but in multiple companies that I've worked in, you know, we've seen this as this is a Cambridge-based spin-out, but all of the lab work is done up here. You know, and we do have really, really good examples of where we feed into supply chains, where we can manufacture what we're capable of. But ultimately, we're not very good at singing about it. And politically, we're hopeless. And, you know, I sat and, you know, advised some of the North East Combined Authority, and I always question, why don't we have a London office? You know, we used to, but if we're going to do this properly, we need to lobby properly, you know, and people are donating their time and, you know, to go down and do this. But wouldn't it be easier if we actually had people based there to go, well, we have a London office? I mean, could you imagine the BBC if they didn't have a London office? You know, if they all worked out of Manchester, I imagine the politicians would be happy. But, you know, it is these types of things, and we should be slightly more strategic in the way that we represent the North East and the North in general. Because I think a lot of politicians forget that, like, you know, once you get to Manchester, there's another half of the country above it that just doesn't really exist in their eyes.
Any more questions from the audience? Yeah?
With the action, I have a question.
Thank you, Sam.
Thank you. I think I had a talk with you over the Zoom recently. So my question is, like, you have shown one of the slide talking about investment readiness steps. So like 7 to 8 steps, like financial projection, IP commercialization, and like business plan, etc. So at what stage I should look forward for investment? I'm at a stage like my prototype is ready, and like I'm talking with the IP commercialization team. So do I need to follow all those steps to come for the investment, or I can straight away?
It's best to have everything, because one of the things that slows especially early stage deals down is waiting around. So say you've had a good conversation with an investor and then they'd like to see your business plan, detailed business plan or financial forecast. if you don't have them prepared, then it just drags the process out and people get bored and lose interest and move on to something else. Obviously, it's difficult to have all of that when you're early stage, but have a think about which ones you should focus on. So very much, I think when we were speaking, look at what customer conversations and commercial conversations have you had to date? How can you take those to really strengthen your opportunity? And then, yeah, we can work around bits and pieces. Some of them are very easy to jump past because obviously with your team, you know what your team is at the moment. You understand who you need to bring in anyway. But around the financial forecasts or any of the IP and things like that, it's better to have those because the main thing you want to do is exchange as little equity as possible for the most amount of money, to be brutal. And so if you've got someone interested at very early stage, they're probably going to want to take a huge chunk of equity, whereas if you get to the stage where you've got a commercial contract or you've got a roadmap of where to get to, then it's going to come across a lot better, and then hopefully you've got more value within the company.
Thank you so much.
I think it's an interesting one, right? Because you're always in the case where someone wants you to be the next level. You know, if you have a commercial contract, why do you need the investment? You know, a lot of the time what we do is we will look at this and say, you know, we want you to be, you know, show us your prototype works. Are you in human? Have you shown, you know, that you can manufacture it? Well, if you've done all of that, you won't need the investment. So you need to change the risk appetite for those investors and say, this is what I need your investment in order to get to this stage. And the conversation on value and how much equity they would expect to take changes according to who you're talking to. So universities will often sit here and say, well, you're a spin out, and so therefore we're going to take 25% of your company. We're not going to invest anything. And the next investor will come in and go, well, that's a dead investor who will never reinvest. So maybe the model that you need to look at is, we'll license the IP. Has the IP been paid for, etc.? We can take all of this offline. I'm more than happy to do this. And I helped a company last year, not a university spin out, but a company last year who were looking to raise £500,000. And it took about 9 months to work with her to move through this process. We ended up with a investor partnership grant for £250,000, and I found a couple of angels in the region that were willing to do the other quarter. You have your £500,000, you can move forwards. And then the company can actually get traction. And that's really hard when, you know, statistics would say, you know, things are against you. You know, a lady, ethnic minority, da-da-da. But these are not insurmountable, and they shouldn't be. And so when Darcy said earlier, you know, use your network, I can introduce people, I will help, you know, I'll do anything that I can to help people, especially at that early stage, because you're committing to a real part of your life which will consume everything that you do and keep you up at night and everything else that goes with it. So there are lots of people in the room around that will help. It's just knowing which questions to ask and what is reasonable. And that's what we're here to do.
Thank you so much.
Oh, thank you. Any more questions from the audience? No? If you think of, oh.
Sorry, I have 5 or 6 questions, but I'll stop whenever.
No, go.
No, this is about fire ahead.
You've got 5 minutes.
All right, 5 minutes.
1 minute.
1 minute. Okay, we use the term at universities, technology readiness level. And you have introduced a new term today, investment readiness level. And there is another one, I can't remember if I'm sure, it is something along the lines, society readiness level. Am I saying it right? Or something like that. So there are 3 readiness levels there. So there seem to be, I can't draw a picture in my head just now, that's hence the question, that there seem to be overlaps between these 3, and that may vary from scenario to scenario. So in your experience, have you come across those 3 together at the same time, or did you see them overlapping? Or so if you could torch light on these 3 in your experience, and what could be the best scenario? Should they be running in series, or should they be running in parallel, or something, please?
There's about another 3 others as well. So there's manufacturing readiness levels, and then a couple of others that I can't remember off the top of my head.
I think you use this one because that is.
Oh, no, it's okay.
Is it all right?
Yeah.
That makes sense.
Yeah, I'd say absolutely they overlap at times, but they should all be running in parallel because they're for different streams. So the technology readiness level is very much around ensuring that your technology is progressing. The societal readiness level is ensuring that people are going to be able to actually use your product and that society is prepared for it. The investment readiness levels and then commercial readiness levels is to ensure that the business is progressing along with that technology at the same time as well. So they are all quite similar, but it's just understanding that, yeah, they all need to be going. And I think the reason that we put the investment readiness levels together was just the fact that there wasn't really any sort of process. People would say they were doing investment readiness, but that didn't really mean anything. So we just wanted to get a structure so people can come to us at a very early stage, and we might not get them investment, but we'll progress them to 5 or 6. So we can show that, well, actually, look, this is the journey that you've gone on. We're not quite at investment ready, but we have got you here. And I think it just helps to sort of expectation manage as well with the earlier stage people. But absolutely, all should be going at once.
I think, I disagree with your slide slightly because I ran the slide backwards from 9 to 1, and I reckon probably 9 could go where 1 was, and then you could work your way backwards. Investors are there for a reason. They have their objectives. Try and empathise with what they want, and you'll understand why they say no so often. They're being judged. They're raising money. They're being judged on what they invest in. They're being told when they have to pay that money back. So if you look like a long-term risk and they've got a portfolio full of long-term risk, you're probably not going to get in. But they know others as well. And I think often having one conversation, and I ask this quite a lot, if you have an investor, what are they doing to introduce you to the next level investor as well? That is their ecosystem, that is them protecting their investment. So are they actually doing that? I think when it comes to, you have to have a certain amount of all of those things in order to sit in front of an investor, but they don't have to be perfect. They know that, that you're trying your best to get here. And often it is as important that you, as a person, are selling what you want to do. Because a lot of the time people will spend loads on paperwork, but actually then can you present it? Can you justify why you want their money to get to where you want to go to? And are you realistic about where that money's going to get to? Because a lot of the time people go, well, I only need $500,000. And they go, how far does that get you? And they go, you go 9 months. And you go, well, that's not long enough for the next round. So we're out. They're not going to do it. If you said, I want 2 million and it'll get me 2 years, they might do it. So never be afraid to ask for more, because they'll probably stage it anyway. But try and be realistic about how much things actually cost and where you need to get to on that. And like you say, manufacturing readiness levels, are you outsourcing it? Is it protected? Do you have the IP on it? How do you generate more IP on it? How do you build that portfolio? And if it's revenue based, where are you selling? How do you reach those customers? How do you compete with others? Are you unique? How do you protect your uniqueness? So I think being really honest about what your company is, how you want it to progress, and how you want that company to exit for that investor is important. Because a lot of the time people go, oh, we'll get bought and away we go, and that's true in this type of game in drug development. But it's not true if you're doing a service company. The service company that I ran was very much a case of how much do you make each year, what's your EBITDA, what's the multiple, and so therefore that's what your company's worth. And when you're making money, 7-8 million a year, PE houses phone you up and say, we want to invest, we want to grow your company. We will give you the capital to do so because you're profit making. So your risk is lower, your long-term longevity is there, and so therefore they're looking for growth. And this is one of the problems, going back to government, they all want growth companies. Growth capital is available. That's not a problem. Innovation capital is difficult to get hold of. So I think a lot of the time what they want is companies to grow here. but therefore we have to attract investment, and that goes back to your question about, you know, how we actually use government money to do that as well.
That's it. Thank you, everyone. Thank you to the keynotes and for being on the panel. That was really, really interesting. I'm not just saying that, that was fascinating. Thank you to all the audience for attending, and if you've attended previous sessions, thank you for that. And thank you in anticipation of you completing the evaluation survey of the Talking Point Tuesdays. I would really appreciate that. So just going to draw to a close. If anyone's booked for a one-to-one session afterwards, can you just raise your hand and we'll come and find you and take you upstairs? That sounds bad, doesn't it? Don't mean it like that. We'll take you to the meeting rooms upstairs for your expert in virtual residence session. Thank you all.